Hey guys, today I'll be sharing the health belief, practices, and values concerning the Amish. As Kimberly defined the cultural group, I'll spend the next few minutes to talk about the Amish's health culture, their beliefs and values as it comes towards health. I would like to start with the family. The husband carries the primary responsibility for the financial and spiritual well-being, and wives typically devote themselves to housekeeping and motherhood. The children are expected to do farm chores at a very early age, and they work as a unit. And they live very, very simply. One of the cultural phenomena that I've found is related to their biocultural ecology. Essentially, this is a genetically closed population. Most Amish are of German and Swiss descent and can trace their heritage to approximately 112 founders. They don't recruit, and genetic disorders have hit them very, very hard related to this closed loop. Because of the increased genetic disorders, they're seeing higher statistical instances of cystic fibrosis, hemophilia, dwarfism, Down syndrome, and other neurological syndromes. There are some syndromes that haven't even been named yet and are only found within the Amish population, such as in Ohio. The Amish consists of 10% of the population, but are recording 33% of the social supports and needs within the community. So this deals with how the Amish look at pregnancy and child rearing practices, knowing that there's these genetic disorders. The Amish don't believe in birth control, for one, because specifically fertility is seen as a family and community gift. Prenatal care is most common with pregnancies, but prenatal diagnostic techniques and genetic testing are not allowed or used. Children are viewed as gifts from God, and they don't mess with it. Most Amish women prefer to give birth at home and tend not to go out to hospitals, but they will. When we look at the total population in general, when we're not dealing with these genetic diseases, there's other common health conditions within the culture. One is obesity, limb girdle, muscular dystrophy, dwarfism, polydactylism, hemophilia B, manic depressive disorder, and it goes on and on. Other high-risk behaviors that the community involves that's beside building the community and the child rearing, they work on a farm. And that is a high-risk environment. There's a lot of farm accidents, especially with animals, getting kicked by horses, falling off of horses. They have problems with traffic accidents and transportation-related injuries. They fall from ladders and fall down hay holes. So they do have some natural risks involved with their simple lifestyle. One of the things that they do have going for them is the Amish nutrition. I was unique to find out that most of the homes lack modern kitchen appliances, and most meals are cooked on a fire or wood-burning stove. The Amish make a variety of baked goods, homemade bread, cakes, pies, pastries, and they don't really consume alcohol. If they do, they don't drink in excess, and they enjoy it on special occasions. Special meals are on Sunday, otherwise they just have simple meals as well. And those special meals include bread, meat, vegetables, and black coffee. I love this, that the Amish still do not eat any processed foods, and they eat a very well-balanced diet. And when looking at cancer incident rates, the Amish are remarkably low in cancer. It's just the lifestyle that they live is so supportive. And due to this lifestyle the Amish have, includes manual labor or exercise, growing of fresh fruits and vegetables organically, and using them in home cooking. They use little alcohol, no tobacco, and they are at a lower risk than most of the general American population. Other factors that relate into the Amish cultural belief on health is related to their education. The Amish only receive an education until the 8th grade. Their knowledge about the body and how to care for it is very limited, And this really influences their health promotion practices. They feel that education is more God-like, being all-knowing, and they try to stay very humble and try to keep their ego at a minimum. There are factors that contribute to the Amish healthcare practices, and that's their religion. They really view their bodies as a temple, and they will protect it to the utmost. Their physical labor, their physicalness is a very highly sought after attribute. When looked at what the Amish's definition of health is, and I quote, is typically someone who has a good appetite, looks physically well, and is able to do rigorous physical labor. This is a really shallow definition to me and really does not look at health as a nurse would in really defining areas. The Amish, although have some barriers, their ability to work as a group and a community is absolutely incredible. When one of their community members is sick, everyone pitches in to make sure that their job is fulfilled. This includes on mental health and other disabilities within the community. The Amish, when they do need to access medicine, there are some notable barriers to healthcare. A few of those barriers are transportation. They're so isolated, it's very difficult for them to get where they need to be to take advantage of services. Language, they speak Pennsylvania Dutch as well as English, so there's mild language barriers that need to be considered. If you needed to contact them, there's really may not have a phone. And usually, typically paying for healthcare services are paid for the church. They have to get permission before coming out. And sometimes the things that they need to be taken care of by the church. So sometimes those decisions aren't always in their hands. Interestingly enough, when the Amish do seek help for healthcare, they've probably contacted a local Amish herbalist. They've probably seen a chiropractor already. They've probably seen a reflexologist or an acupuncturist. This is typically, you're the last person that they want to see as a clinical office or a doctor's office. And mostly it's because they have to consult church elders and bishop before going out for outside health care off the Amish grounds. When they are using our healthcare system, they're untrusting and they're very hesitant to take prescription medications. You have to be careful when asking specific questions if there are any medications because they're probably on a home herbal regimen or some vitamins or whatever that may interact with drugs that are at home. Again, because of their education and their beliefs, Amish do not value health promotion and disease prevention. Although they do get some immunizations, but it's hard-pressed to convince. They don't believe in birth control measures. They don't believe in abortion or genetic counseling, as we spoke before. I didn't know this, but Amish culture is very accepting of modern healthcare and facilities that they provide. Again, they just have to make sure that their local bishop will approve. I've seen a few studies, and I couldn't find the information to give a statistical reference, but Amish use a wide variety of herbal supplements, typically found multivitamins, vitamin C, flaxseed, and fish oil were of the most common, and they used other natural remedies for cholesterol and hypertension, such as niacin, taking omega-3 fish oils, and coenzyme 10, as well as herbal remedies to boost immune systems, such as echinacea and golden seal. Things to remember with the Amish, they're such a fascinating group and they have such a culture. Please remember that the Amish believe in folk medicine, faith healing, and herbal treatments. They believe that there's a higher level of medicine and that's God. That God will take care of you. And that's the way it is. The Amish are very careful medical consumers. If an Amish person is seeking medical treatment and indicates that, hey, this is an emergency or a very important concern, they're very careful about who they see. And it's just really interesting to read. Another fascinating thing that I found out, the Amish religion doesn't forbid people to seek modern medical care, such as surgical procedures, blood transfusions, organ transplants, except for the heart. They believe the heart is the soul. The Amish don't believe in insurance. They don't carry it. They feel that it's a worldly product and takes them away from their community. Um, Again, Amish pay very little attention to preventative care. It is hard to impress upon them the importance of immunizations for cancer, pap smears, mammograms, and this is largely because, again, they believe God heals them. As a healthcare provider, you should treat the Amish a little bit differently. Amish patients prefer to be on a first name basis. They also prefer doctors who will sit with them and discuss their health one to one. The suggestions that I've read ask for us to speak to them at an 8th grade level, that the Amish learn well with demonstrations, pictures, stories, and role modeling, and they really want take the time to educate them. They want you to speak to the husband and wife for a response on healthcare decisions if needed. You see, the church plays such an important role in their life that that decision isn't always up to them, and that you are clarifying that you need direction. When seeing an Amish patient, don't discuss money. Money is a very touchy subject because of the inability to pay. Also, discuss all possible treatments and interventions so you can take care of as much stuff in one place and time as you can. Talk about treatments that may not be able to be implemented because of lack of use of energy, money, or just their technological limitations within their society. Remember, when prescribing medications, that they may not have the means of keeping them consistently cold. I've covered a lot here. It's very, very fascinating. I felt like I was going over my time, so I rushed a little bit at the end, but I wanted to thank you for watching, and Jamie will cover the culturally related end-of-life issues in the next session. Thank you so much. Bye.